What is the most common dinosaur in dentistry? Well, over 80% of offices still use paper clips and old paper forms. It's time to bury that dinosaur and move to OperaDDS forms, where for as little as $59 a month, you can get all of your forms online. We've got a slick form editor where you can create your own forms. There's just absolutely no reason to stick with the old school ways. Avoid all the half solutions with PDFs online. Get yourself true paperless forms, any form, any device, anywhere, starting at just $59 a month. Go to forms.operadds.com. Welcome to the Operatory podcast, the podcast about burying the dinosaurs in dentistry, moving past outdated technology and procedures to find a better way. With me, as always, is the man, David Pryor. How are you doing today, sir?
Good, Brian. How are you?
I'm doing well. Although I'm outnumbered today for the first time.
Yes.
That's true.
Yes. We are very lucky to have with us a phenomenal person, Jennifer Fernjack. How are you doing today?
I'm doing well, thank you. Happy to be here.
I'm very excited to have you on.
Great.
On the podcast. Today, you are providing the patient perspective, probably even more so than Dave, because Dave, even though I love Dave's perspective and you bring a lot of value here, as you've talked about before, not much anxiety, right, Dave?
I do not.
And so getting another perspective from a patient that's coming off of that is fantastic. So thank you for being here.
Sure, thank you.
Well, and obviously, well, maybe not obviously, but you are, I think, probably phenomenal patient to give the perspective on patient anxiety as you. Could you just kind of talk a little bit about what you do and your website and your focus?
Sure. So my website is called thepowerofoemotionalgrit.com, and it showcases public speaking that I do about ways that people can actually reduce anxiety in everyday life. So whether it's a doctor appointment, a dental appointment, stress from work, perhaps family issues, that kind of thing, there are ways you can actually try to help yourself, so to speak. Whether it's through music, which of course is offered through dental offices like Dr. Laskin's, where you can use earbuds and bring your smartphone in, that can actually increase your dopamine levels.
Oh, really?
So it's pretty amazing how music can help you in your experience, just like the VR glasses.
Yeah. Could you talk a little bit about your experience with OperaVR?
Sure. So going back to when I was a little kid, I've always been afraid to go to the dentist office. No offense.
No, I always say if I took it personally, I'm in the wrong job. Right.
Right.
Yeah.
So as a little kid, I had a fair amount of permanent teeth pulled. And so I got really nervous about going to the dentist office. And so as I got older, unfortunately, I had this psychosomatic response to even just going to the dental office where I would get nervous before I even got there. And there have been times over the years where I have actually passed out in the dentist chair, just knowing what was coming. I mean, just knowing that the actual needle was coming. It hadn't even happened yet. And before you know it, my ears are ringing. I'm getting tunnel vision. I'm getting sweaty palms. And before you know it, I'm out. And with the VR glasses, it's the complete opposite. And by wearing those, first and foremost, as the patient, I can choose which scene that I actually view in the VR glasses. So whether it's a scuba scene or perhaps being out in the middle of the city and enjoying the city lights, or perhaps a nature scene with birds and tall grass and water, I have a perceived sense of control because I can choose which scene is relevant to me. So for me in particular, I chose a scuba scene because I've had vacations before where I've been in the ocean and had a good experience as far as the coral and the fish and all that, very relaxing. So by wearing those in the dental chair, I could actually forget where I was. And it's pretty amazing. And I'm happy to say that I have not passed out since I started using them.
Well, that's great. Well, and I think, I think it's important to point out that, as a patient with dental anxiety, you probably feel like your experience is more unique. But when you're talking to people, I'm sure you're finding other people who have the same levels of anxiety. I mean, most of our listeners are dentists. So
yes.
Every dentist has quite a few patients if you have a practice of any size. Dental anxiety is not uncommon. And in fact, 80% of adults in the U.S. have some type of dental anxiety. But I think that we as dentists become desensitized to it because we have to work every day. One of the things that you talked to me about too was the kind of the toll that can take on the dental team.
Absolutely.
So do you want to talk about
Sure.
that?
So in my opinion, the benefits of the VR glasses are threefold. First and foremost, they benefit the underlying patient like myself and help kind of give you an item to concentrate on that's positive and to not think about the experience you're having with the dental procedure. On top of that, it's beneficial to the caregiver. So whether it's a parent taking a child to the dental appointment or perhaps a spouse knowing that the spouse who's in the dental chair is nervous. And then, of course, with the dentists and the dental assistants and hygienists and you name it, it's going to help your experience as well because your patient is then there maybe laughing or smiling with you, that kind of thing, rather than having the sweaty palms and the enclosed vision like I've had. And by having that positive experience, it's going to help you look forward to going to work, not just the patient looking forward to going to the office.
There's probably a fourth person. It's the, like in my case, it would be my wife doesn't have to, hopefully I don't come home with as much stress too. Right?
Exactly. Well, and if you think about it, just the dental profession in and of itself, you're working in a confined space. I mean, the mouth is obviously a small space. You have a lot of responsibility, a lot of things you have to think about at the same time, on top of the fact that your patient might not really want to be there. So it could add a lot of stress to your plate. And this is a great way to try to deviate from that.
I just appreciate you being here because I think having sort of a patient's perspective, as particularly with virtual reality, I think that it's easy for dental offices who listen to the podcast to think, oh, all VR is the same, or this is a toy, or it's another gimmick. You know, if you've been in the industry at all, there's so many things that come to the industry and go and kind of gimmicky or don't actually change things much or require a lot of effort to get integrated into your office. And so having and virtual reality is certainly something that when I talk with patients about it, they seem to get it before dentists and dental teams.
I could see that.
Yeah.
The thing, too, as far as the fact that not all VR is the same, I completely agree with you. Because if you think about it, when pilots get trained to be a pilot, they have a virtual reality, like you're in the cockpit and you're like a simulator. You know, you're pretending that you're flying and you're really into it. It's very exciting and your heart is racing and all that kind of stuff. Well, your VR is the opposite. It's relaxing you. It's helping, lower your heart rate and the fact that you're, normally very anxious in the dental chair. It's the opposite. So it's completely worth it.
Yeah, and you mentioned using an iPod, and that's one of the things that we worked hard to do. As a patient, you can select what you want, but we have the control, whereas unbeknownst to you, when every time you're like looking at the iPod to try to find the song, it can be disrupted for the dental team, right? So it's nice to have not just the content tailored to the dental patient, but also the experience is better for dental teams and for patients because then you don't have to screw around with the headset looking for something. You just ask for what you want and we can make it happen.
That's true. And I know that a lot of times dental practices are nice enough to have a TV in the actual room where the patient is. And that's nice. But the thing is, TVs have commercials. Whatever TV show is on, maybe it's the news or something, might not be relevant to that particular patient. Whereas if the patient, again, can choose their screen on the virtual reality experience, it's tailored to them. And a great example of that is people with Parkinson's disease. There are studies now that show that people who are shaking because of the Parkinson's disease are less apt to shake if they hear music that's relevant to them while they're dancing. So there are nursing homes who will purposely play music. Now, for me personally...
I think you just broke Dave's brain right there.
Or he dozed off. I don't know.
To be fair, it came pre-broke.
Okay, there was a rift, and now it's full crack.
Yeah.
Gotcha.
Right. So again, there's this term that psychologists use that's called salient stimulus. It's kind of a crazy word to try to say, or two words. But basically, stimulus is more relevant if it's actually of meaning to that person. So, for example, if I walk into a room and I see a really shiny motorcycle, which I can appreciate, and a puppy, I'm going to gravitate towards the puppy, because that's of meaning to me, and I'm not knocking the motorcycle, but my item would be the puppy. And so with this, if you can actually choose, again, which scene you're using with the glasses, it's going to have more meaning to you.
Wow, I wish I would have known that when I actually developed the adventures. It was I just wanted to have a bunch of adventures, but that's amazing. Thank you for bringing that up. Could you give, we talked about virtual reality in dentistry and the power of emotionalgrit.com, your website. You have other experiences beyond dentistry that you were telling me about right before we started the podcast. So could you, I just think it's neat. And there's probably ways to leverage that in dentistry in addition to, the virtual reality, which transforms patients' experiences. You've been in other practices that are doing other things. So could you talk about that?
So as part of the research that I've done for my public speaking, I learned about a children's hospital in Pittsburgh where they had a high sedation rates for the kids that would come in, either for a PT scan, a CAT scan, an MRI, anything with a real ominous machine where they were afraid to be there. And because these kids would oftentimes be crying and not want to lay still in the chair or on the table, it would prolong things. And maybe in a given day, you could perhaps have, say, for example, 10 patients come in. Maybe this day you only have 5 because things are taking so long, Not to mention the fact that it's a bad experience for the patient and their caregivers and what have you. So what this hospital did is they decided to design the rooms with themes. So each room with this scary machine has its own theme. So one, for example, is a jungle. One is a pirate ship. One room has a scuba diving scene with a submarine in it. And the one in particular with the jungle scene, the actual MRI machine is decorated. I should backtrack. The actual pirate ship theme. And this one, the pirate ship is set up so that you actually feel as a little kid that you're on a ride at a theme park. You're going into a pirate ship. And the floor has decals. The windows have markings on them as well. The walls have murals. And then the actual staff, whether it's nurses or radiation techs, are also trained to be in theme with the room. So, for example, a nurse might say to a patient, now make sure you lie really still. You don't want the pirates to know where the treasure is.
Oh, gotcha.
And because they were in theme with that, and because the kid thinks they're going into a pirate ship, so to speak, they were actually able to lower their sedation rates between 2005 and 2007 by 99%,
Wow.
which is amazing.
Wow, there's so much of psychology that goes into all of this, right? And with VR, we've recognized how it actually virtual reality, therapeutic virtual reality, mimics opioids. So and similarly, you can get to the same parts of the brain in different ways. And you were talking before we began the podcast too about how that transformation doesn't just stay in the dental operatory too.
Exactly. It goes beyond the dental chair. So, for example, not only are patients like myself oftentimes nervous to be in the dentist chair, there were times I would dread even going there. So I'd be worrying about it and having anxiety before I even got to the dental office. And so by actually having these positive experiences, it gives you confidence for the next time. So the next time you're not dreading it per se, you might actually look forward to it. Like, hey, I want to catch up with the dentist, find out how his fishing trip was, or catch up with the hygienist, find out, whatever. I mean, it's more the human element, and the benefits of the glasses go beyond the chair.
So, one of the things that I think is any dentist will resonate with, or anybody in the dental team, is that there's people who have had one negative experience when they were 6 years old, and now they're 50 years old, and they still hang on to that experience from when they're 6 years old, and that's where their anxiety was. And maybe they didn't even have anxiety. Their mom or dad talked about how much it was going to hurt, and then that propagates it. And kind of what you're saying is that virtual reality can break you out of that cycle a bit. That's very interesting. Yeah,
it can. And there's another term that's called cognitive reframing that psychologists use, where it's not so much the item you're fearing as it is how you're perceiving it that makes a difference. So, for example, a few years ago, I had surgery for a tumor that was between my optic nerve and my pituitary gland. And as part of that, I had to have a number of MRIs. And people had warned me ahead of time. They're like, you're going to get claustrophobic in the MRI machine. You're going to feel like you're buried alive. And I wanted to say to those people, okay, you know what? You're not helping. Throw me a bone here. So what I did, not knowing that it was called cognitive reframing, is that when I got to the hospital, I looked at the machine and I pretended that I was back in high school using a tanning booth.
Oh, really?
So it's not the presence of the enclosure, it's how you're perceiving it. And I'm happy to say I never once felt claustrophobic. So carrying that over into the dental world, it could be perhaps a suggestion by the dentist or the dental assistant. Maybe instead of saying, okay, here's the Novocaine, maybe just say, hey, it's going to be a mosquito bite. Or perhaps your cat's scratching you. Because if my cat was scratching me, I would think that was cute. So it's how you're perceiving it.
I say sleepy juice.
Right.
Now, cat scratching, you could freak somebody out with that one.
Right. It pays to ask the person up front,
yes.
and maybe get to know them if they're a pet person, or else, that'd be kind of weird.
It's your goldfish sucking on your...
Exactly.
No. Well, thank you very much for being here. I truly appreciate you coming in and bringing another patient perspective beyond just Dave's. So
that's fantastic.
Well,
fantastic. Yeah.
Thank you for the opportunity, and anybody who's listening, thank you for doing what you do. I know that's not an easy job, and that people like myself might make it, before the VR glasses, that it's not that ideal to be there. But things like this can make a huge difference, and I want to say thank you.
Oh, you just made a lot of dentists' day. Appreciate that, including this one. So thank you.
Good.
So if you want to learn more about OperaVR, go to digitalnitrous.com. And to learn more about Jennifer and her speaking, which is amazing, go to thepoweroфemotionalgrit.com. The Power of Emotional Grit. Thank you.
Yes. Thank you.
I also want to remind you to rate and review us wherever you're listening to this podcast. And if you have suggestions or comments, please visit theoperatory.com and drop us a line. Again, I'm Dr. Bryan Laskin, host of The Operatory. Thanks for listening. I look forward to speaking with you next week.